Greetings, my name is Jerice Lee, and I am a Master's of Public Health student in the Program Planning and Evaluation course at the University of New England. Today we're going to speak about the Precede-Proceed Model. So the Precede-Proceed Model was developed in 1974 by Mr. Lawrence Green. It was meant to be a cost-benefit framework, meaning that you kind of look at the review of that specific health issue and you think about the different way that you can leverage resources to help and assist with addressing that focus issue with a cost benefit. It was designed for public health utilization, but it also extends to community intervention in that it uses the community as the foundation of its health promotion. So it's just not a public health, it's just not used for public health, but it can extend in many ways over public health and into different issues that it can address. So what is precede? What does precede-proceed mean? Precede means predisposing, reinforcing, and enabling constructs in educational or environmental diagnosis and evaluation. So basically the precede part of the process is those elements or those elements that basically lead up to the intervention. So you have several assessments in the precede part of this model, and it's going to take a look at the community and do a couple of surveys and analysis of the community so that you can really identify those key aspects and health barriers of those issues. Then you have the proceed part of the model, and basically that's the policy, regulatory, and organizational constructs in educational and environmental development part of the model. And it basically shows you how to implement your intervention. It gives it gives strict instructions on how to integrate that specific model after you have done your assessments. So some strengths of the Precede-Proceed model. It's very comprehensive. It provides a flow chart that can be tailored to the community. It also evaluates the influence of policy and administration, which is really key because a lot of our health issues are influenced by policy and administration. And so if we create or really take a look at these policies and administration and really tailor it to what is needed in the community, we can really make an impact in health. And it also provides some evaluation templates, some well-defined evaluation templates. So some of the weaknesses of the Precede-Proceed model is it's data-driven. It collects a lot of data, and you have a lot of key partners or key aspects that play a part of this data. So you need a lot of data. It involves a lot of data collection. And then it's time-consuming and requires a lot of resources. The Precede-Proceed model, again, is very comprehensive, and so it's not a simple framework to integrate because it's taking a look at a lot of aspects. It's taking a look at it very comprehensively as well. And then also the intervention development is not specific. You know, it has a lot of leeway for you to be able to develop, which could be a pro or con. It has a lot of leeway for you to be able to develop what's really needed for that specific community, but it doesn't give you specifics on your intervention development. So the phases of the Precede-Proceed model, you have about 9 phases: social diagnosis, epidemiological diagnosis, behavioral and environmental diagnosis, educational and organizational diagnosis, administration and policy diagnosis, your implementation, your process evaluation, your impact evaluation, and your outcome evaluation. And so a good key aspect of the Precede-Proceed model, and which is very unique, is it starts at its end goal. And so you're going to look at where you want to go first with this model. What is the problem that needs to be addressed? And then you work your way backwards. So some of the lessons learned while integrating this project is, again, that you have to define your goal. And when you use a Precede-Proceed model and defining your goal, I feel as if your project is more focused because you're going directly to look at your problem, your issue, and then you work your way back to figure out what are those things needed to address that specific issue. So I think we're starting out with your end goal. It helps you to focus your project more. I think also what's essential is your community partners. Community partners are very well needed in order to have success in this project. You need partners as far as our diabetes project that we had to do on Wilcox County. I think it was very instrumental for the health department needed to be involved. Not only the health department needed to be involved, but also the other aspects like students and the community in order to resolve the issue of high diabetes prevalence in this specific county. Also, administrative policy change was greatly needed. You really need to look at this because, for example, with the Wilcox County, there were no diabetes programs that were available. So we really have to look at those influences that really keep these health issues kind of going and how we can address them. A big barrier probably of the project that I conducted on Wilcox County is, again, with the Precede-Proceed model, data collection is very extensive, and we had several data points, and a lot of times we had, in this particular intervention that I created, we actually taught in the proposal, we're going to be teaching these patients how to do those self-checks. And so it has some room for error because you're going to have the patients doing those self-checks and reporting those self-checks. So you can have, a little bit of error there if they do not perform the correct way of conducting those checks. And then another aspect is participant eating habits. Though the curriculum that we're going to develop, well, with the proposal as far as for the Wilcox County, it has to do a lot with the participants' eating habits as well to help reduce diabetes in this particular area. And so a lot of people are already in the mind frame of how they eat and things of that sort. So sometimes it takes a little longer, even when you're introducing healthy habits, for people to catch on. So I think it'd be very important to influence healthy habits as much as possible. But sometimes it does take time for people to make those behavioral changes. So some suggested changes from the program, I would say easier data collection system. Try to think of a way that we can collect the data with less error. Also just thinking of some alternative exercises because some people in the program probably cannot exercise. So I think another aspect of this program is to think of those patients that cannot perform high impact exercises, alternative things that they can do. And that is my presentation on Precede-Proceed. Thank you.